Good afternoon, student. How you feel? How you hear me? Hello. I am waiting your feedback. Oh yeah, fine. Thanks God. Thanks God. Hello. Sorry, it was some technical problems, but now I see you join us. Okay. What is about hearing? Is fine? Do you hear me clearly? Yes, thank you. I see. Okay. Okay, nice. Let's wait a couple of minutes while all of students join us. Okay, thank you. Nice. Today topic, I'm Professor Starchik, and we have the last lecture for autumn semester, for the autumn period of education, and this is the lecture about digestive system. We will talk about organ in the beginning of gastrointestinal tract, and we will talk about oral organs, pharynx, esophagus, stomach, and I hope we will have time to for talking about small intestine. Last lecture we discussed the general feature of digestive organ, and now time to study in more detail, to study some organs in details. And this the digestive system is essentially a disassembly line. Its primary purpose of this system is to break nutritions down into forms that can be used by the body and to absorb them so they can be distributed to the tissues. And moment mal. Okay, and we will talk about some general overview of the digestive system, and then we from step by steps we'll talk about oral organs, pharynx, esophagus, stomachs, and small intestine. I'd like to add that study of the digestive tract and the diagnosis and treatment of this system disorders is called gastroenterology. Gastroenterology is This is a part of medicine about diseases, about and treatment organ of digestive systems. Digestive systems is very ancient systems. It means in evolution it starts to development very early, and digestive organ process the food. They extract nutrients, that is a chemical composition from the food, and then after digestion process, organ eliminate the residue part what was not digested. And алло? Анна Вальтон, да все в порядке, наладилось. У меня что-то связь была. Я сейчас пересел, мы ведем лекцию. Я просто хотел вас попросить их. Я перезагрузил ссылку, все в порядке. Спасибо, нормально. So, okay, спасибо. So, please pay attention to the fact that the certain digestive organs also produces hormones. I mean, these substances or chemical products which regulate all processes in our body. And let me show you all organs of the digestive systems. That is of course organs are located in the oral cavity. I'd like to say that digestive systems is composed of two groups of organs. That would be the gastrointestinal tract, and the second part is the accessory digestive organs. As you guess, gastrointestinal tract or alimentary canal is a continuous tube that extends from the mouth to the anus through the thoracic and abdominopelvic cavities. Organs of the gastrointestinal tract, they marked yellow here in this slide, include the mouth, pharynx, esophagus, stomach, small intestine and large intestine. The length of the gastrointestinal tract is variable. Usually it is about from 5 to 7 meters in a living person, of course. When the muscles in the organs walls or of gastrointestinal tract, when people died, gastrointestinal tract became longer. In corpse, in cadaver, it is about from 7 to 9 meters, because the organs or muscles lose the tone after death. And accessory digestive organs, those organs, they are in white text here in the slide. It would be tongue, teeth, salivary glands, tonsils, liver, gallbladder, and pancreas. These organs have different functions. Teeth aids in the physical breakdown of food, and the tongue assist in chewing and swallowing it. The other accessory digestive organs never come into the direct contact with food, like liver, gallbladder, and pancreas, because they produce or store secretions that flow into the gastrointestinal tract through ducts. So it means all of these organs have ducts, and these chemicals produced by liver and pancreas aid in the chemical breakdown of food. It is secretions what help to digest all food comes into our body. What about digestive system functions? That is of course ingestion. It involves taking food and liquid into the mouth. In other words, it is eating. Secretion, the second function. Each day, digestive organs secrete a total about 7 liters of water, acid, buffers, and enzymes into the lumen of gastrointestinal tract. And this process is called secretion. The third one is mixing and propulsion. It is some kind of motility. Alternating contraction and relaxation of the smooth muscles in the wall of gastrointestinal tract, mixed food and secretions together, and move them toward to the anus, that is the end of gastrointestinal tract. And this capability of the gastrointestinal tract is termed motility also. Fourth, digestion is the breakdown of ingested food into small molecules for use by our body cells. A few substances in food can be absorbed without chemical digestions, including amino acids, cholesterols, glucose, vitamins, minerals, and of course, water. No needs to digestion water, as you guess, and vitamins, they come through the wall of digestive organs without digestions. The fifth function is absorptions. It is very important functions. Entrance of ingested and secreted fluids, ions, and products of digestions into the epithelial cells lining in our gastrointestinal tract is called absorptions. That is the whole name. And absorbed substances pass into the blood. Sometimes they pass into the lymph and then circulate to cells throughout our body. And the last not very representative function, that is a defecation. Vast indigestible substances, bacteria, cells sloughed from the lining of the gastrointestinal tract, and all of this stuff and some digested material that were not absorbed leaves the body through the anus in a process called defecation. The eliminated material is called feces or stool. So this is the 6 main basic functions of digestive system organ. And this picture, it is picture made by me personal. That is my product. of course, all rights reserved. This is the digestive system function, and it is visible, the part of digestive tract. Here is the oral cavity, and in oral cavity located teeth, tongue, and salivary glands, and you see that these organs have different functions. And take a look here. Determining the taste and chewing and mixing food with the saliva, it takes not longer than 1 minute. Usually it is about 30 seconds. And this is the time when the food is located in oral cavity. Then it comes to the pharynx. This is a tube. What is connected oral cavity with the esophagus. This is the next part of digestive tract. And then food through the esophagus come to the stomach. It accumulates food and produces some gastric juice, what used for disinfection of the food, and some of the enzyme in the gastric juice can digest proteins. Then food come to the small intestine. It is another part of digestive tract. Then it come to the cecum. This is the first part of the large intestine. Then to the ascending colon, to the transverse and descending colons, and all of feces come through the anus to the external environment. And this is the last part of the large intestine called rectum, and anal canals and anus, all of those are part of rectum. Take a look also how long we can swallowing. This is just few seconds. Digestion of the food in stomach, small intestine, only this part of digestive tract can possible to digesting food and break down the food into the nutritions. And absorption also takes about 5 hours. So all the time what we spend for digestion and absorption takes about from 4 to 8 hours. Take a look also for the additional organs. Here is draft liver and pancreas, the main secretoring organs of the digestive systems. And the end of the important thing that the liver and pancreas secret come into the small intestine. No possible to when these secrets come to the stomach or large intestine, only in small intestine. And the last process we call defecation. It takes from 10 hours to few days. So you can imagine how long is the process of the whole digestive the food in our organism, in our body. Okay, and next we start to study oral organs. Oral organs, of course, here first of all we can understand what does it mean oral cavity. Oral cavity, that is the cavity in the beginning of digestive tract, gastrointestinal tract in our body. And oral cavity has two part. First part we call oral vestibule. It is a slit, like a slit space. Here I can show you this part here. This is the oral vestibule, and it is located between teeth, between cheeks, and between lips. This is really like a small slit rounded around the jaws and around the gums and teeth. The bigger part of oral cavity we call oral cavity proper. This is, let me draft and show you this. This part is, you see, this is quite bigger, and it is formed by gums and teeth from the anterior and lateral position, and it is formed by hard and soft palates, and from the lower part it is located tongue and muscles, some muscles of oral fluid. You see that the entrance to the oral cavity we call oral fissure, and this is the entrance. But the outcoming, this is the fauces. This is the fauces, and this is the fauces or fossal isthmus is between the tongue and between the soft palate. So please don't forget that oral cavity has two parts and two foramens, opening and entrance and exit. Okay. Oral cavity has a special layer. We call it mucosa or mucosa layer sometimes, and it lines the whole oral cavity. And it is visible here if you open your mouth and look inside. I recommend you to do that after our lecture. Please take a mirror and some kind of light source and look into your mouth, and you see all of anatomical structure. First of all, you can see teeth and gums, and this is the border between oral vestibule here and oral cavity proper. So it is a two part of oral cavity, and oral cavity has four walls: lateral, as the cheeks. Sorry, this mistake. Cheeks not with two e, and anterior wall. There are lips on the anterior wall. Upper wall. Those are hard and soft palate here. It is visible here. Here hard palate, and to the posterior part is a soft palate. and the lower wall is the tongue, and some neck muscles or muscles of the oral cavity. Let's see the some feature of the lateral walls of the oral cavity, and that is the cheeks. Those are cheeks. Cheeks form the lateral walls, and they are covered externally by skin and internally by a mucous membrane. So I would say that the cheek has a multi-layered structure, and it consists of skin, buccal fat pad. Here is buccal fat pad. We call it also corpus adiposus bucca in Latin, or it is named Bichat fat pad. Bichat, this is a anatomist from French, and his name is this fat pad named after Bichat. Buccal muscles is here. This is a quite big and strong muscles here, and mucous membrane is inside of. Sorry, let me. It is visible that from the internal side is a mucous membrane, and I would add that Bichat, he is a name. This is French anatomist. Bichat fat pad is very important for the sucking process. When baby start to suck the milk, mother's milk, this anatomical structure, this fat pad help to do that, and it also provides an individual face shape, and it protects the external structure from the altering when we chewing, and it makes it. Of course, it has a structural function and help us to build the cheek as own anatomical structure, as own wall, as lateral wall of oral cavity. Anterior wall, lips. The lips, or labia in Latin, labia in this is a plural. In plural, labium. This is name, simple name, but plural name is labia. It means fleshy borders. Labia means fleshy borders, and the lips are fleshly folds surrounding the opening of the mouth, surrounding the oral fissure, in other words. Lips contain the orbicular oris muscles. It is visible here. Here, this is the fibers of the orbicular oris muscles. You see, there are a lot of muscles come into contact of the oral fissure, because this opening serve as not only for taking food into oral cavity, but also for speaking. So this is a very movable part of our face. And lips have a special form, and you see this is we call angle of mouth, and lips have two zones: skin zone or skin part. This is a zone between mucosa and skin, and usually this part is red. We sometimes call this intermediate part as vermilion. And inside we see a mucosa layer, and in that layer located a lot of small salivary glands. It is here. All of these structures are salivary. This is a small salivary glands which are located in mucosa membrane of the lips. Mouth floor. This is a floor of oral cavity, and it is formed by generally by two muscles, mylohyoid and geniohyoid muscles. Here, this is a mylohyoid muscles, and this one is geniohyoid muscles. And of course, the tongue, our tongue is also forms the floor of the oral cavity. Important things you have to know that under the tongue, this is a mucosous membrane lines the lower part of oral cavity, as well as tongue and muscles here. It contains many veins. So doctors recommend to use these vessels, blood vessels like veins, for absorbing some drugs or some medicine directly into oral cavity. We call this way of absorbing drugs called sublingual way for using medicine for using drugs in medicine. Okay, and this is visible, and usually it is possible all of the chemicals can come through the mucosal membrane. Here should be short molecules. They should have short molecules of and it is possible to transport very easy to the veins and come in our blood. We don't have a lot of drugs that can use in sublingual way of taking medicine. Okay, and the upper wall of the oral cavity is hard palate here. It separates oral cavity from nasal cavity, of course, and it is made from the maxilla, and the posterior part of hard palate is palatine bone. So it is the bone, because the bone is very strong and hard. We call this part of palate hard palate. But the posterior part of the palate we call soft palate. It is made from mucosa membrane and muscles. Usually soft palate closes nasopharynx during swallowing. It means that it close the pharynx and doesn't make possible that food or fluid come into nasal cavity. And the interesting part of the soft palate is uvula. It is like a finger-shaped formation or structure, dangles from the center of the posterior margin and has a muscle inside. And as you see, the uvula prevents fruit from entering the pharynx too soon. It make the process of swallowing longer. And you see that people have about 5 muscles in the soft palate. 2 of them we call muscles. Let me tell you in Latin: musculus tensor velli palatini. Here is musculus tensor velli palatini. And this one is called musculus levator velli palatini. So this is muscles that move soft palate up. This is the muscles uvula muscles here, and two inferior muscles. This is first one is palatoglossus. It comes from the velli palatini. We call this part vellum palatinum, and it comes to the tongue. So palatoglossus muscles. And the posterior is called musculus palatopharyngeus because it's come to the pharynx. And this opening you see, and I hope you can see today when you examine your oral cavity, you can see this is the fauces. This is the opening from the oral cavity to pharynx. Okay, next organ is tongue. Tongue is accessory digestive organ, and it is combined. It's combined from skeletal muscles and mucosous membrane. What kind of function has tongue? It is, of course, manipulation of the food, and it prepares food for swallowing. That is, of course, important sensory organ because we can feel temperature and taste because of the tongue. It has also some plenty of glands, and they produce enzymes called lipase. This is enzymes what break down lipids in the food. And of course, maybe for human, this is the main function. This is this speech production, or we can talk clearly thanking to the tongue. As you see, tongue has two parts. This is the dorsal or posterior part here. Posterior part we call root of tongue. In Latin, it is radix. And anterior part, the main or basic part, is body of tongue. And the end of body is the apex. So when you open mouth and see inside, you usually see dorsum of tongue. This is the upper surface of this organ. And if we take a magnification loupe and see on the surface of dorsum of tongue, we could notice small appendices, small structures, what calls papillae. And this is under magnification. And usually there are four kind of tongue papillae. The biggest one here, this is the palate papillae. Usually they serve as a test receptors. Fungiform papillae here, they looks like a fungi, like mushroom, and they have also function to test the food. Filiform, small one, usually use the role of not for testing, but for this is the senses. When we touch something, or we can measure the temperature of the food. That is, of course, the role of filiform papillae as well as foliate papillae. Sometimes foliate papillae can have also can test the food also. And this is the geography of geography of the papilla, and you see that the different tests can be possible to locate it in the dorsum, in the dorsal part of the tongue. Usually sweet is apex, salty is the center of the body, and south usually this is the lateral part of tongue, and beta test is located near to the root of tongue. Because tongue has a lot of muscles, we divided all of tongue into the two groups, that is extrinsic muscles and intrinsic muscles and intrinsic muscles. What the difference between them? This is extrinsic muscles. They attach to the bonus. It would be styloid process, it would be hyoid bone, it would be mandible. And all of these muscles, styloglossus, hyoglossus, and genioglossus, they move tongue in oral cavity. But intrinsic muscles, they originate and insert into the connective tissue. They located inside of the tongue. It would be four muscles: superior longitudinal muscles, inferior longitudinal muscles, vertical muscles here, and transverse muscles here. All of intrinsic muscles change the shape and size of the tongue when we speaking or swallowing. Next, organs in oral cavity, of course, that is the teeth. We study teeth very good manner for stomatologists, but for doctors, for general doctors, we also pay attention to these organs. Another name of teeth are dents in Latin, or odonta in Greek. That is accessory digestive organ, and they are located in mandibula or maxilla. They connect, they join to these bones, and of course these organs, teeth, perform chewing or mastication of food. This is a two name: chewing and mastication in Latin. The typical tooth consists of three parts: the root, usually root or it would be from 1 to 3 roots in one tooth, and all of roots are embedded in each socket. Here is the socket in mandibula or maxilla, and roots are embedded in each socket. The crown is visible. Here is the crown, and crown is the visible portion above the level of gums, and the part between crown and root we call neck of tooth. You see in this picture that the typical tooth has different tissues. First one we call enamel. Here is the white enamel, and made of calcium salts, and it protects the tooth from wear and tear. It is very hard tissue, the hardest tissue in our body, called enamel. Next is the dentin. Dentin, this is a calcified connective tissue, and the dentin makes up the majority of the tooth. Inside of each tooth we could find the cavity, and we call that pulp cavity. And pulp cavity contains, of course, pulp. What is it? Pulp is a connective tissue containing nerves and blood vessels. As you see here, inside of pulp, you can see blood and nerve, blood vessels and nerves. And we could also see the tissue called gingiva here. Another name is gum. And it is out of teeth. It is covered the alveolar process of mandibular and maxilla. But the thin layer of cementum, it is a bone-like substance that attached the root to the periodontal ligament. And here you see the periodontal ligament. This is a connective tissue. So each root is covered by cementum, and cementum attach the root to the periodontal ligament. We call all of this structure cement and periodontal ligament together, we call parodont. So this is a very famous disease, parodontose, when people lose their teeth, if the parodontal layer is thick. And you see also the apical foramen here. Apical foramen. Each root has a small foramen called apical one, and this is a opening at the base of root canal, through which blood vessels and lymphatic vessels and nerves enter a tooth. When people have inflammation and some caries, this is a disease of the teeth, and when the microbes come into the pulp cavity from outside, from the oral cavity, I can add that oral cavity is very dirty place. That is the dirtiest place in our body. A lot of microbes are located in oral cavity, and if they come into the pulp cavity, it would be the process called pulpit. We call it in Latin, pulpit, and that is very pain. It is pain process because this inflammation it gave not possible nerves. I would say this is it is very painful process. So people need immediately go to dentist and fix this problem. What kind of types of teeth we have? There are 4 types, and this is incisors here. Incisors are blade-shaped teeth found at the front of the mouth. Incisors clips and cut food, like beating of the tip of the carrot stick. The second type is canines or cuspids. This is another name, mostly English. Cuspids, Latin caninus, English cuspids. It is usually canines are conical teeth with a sharp ridgeline and a pointed tip. These teeth tear and slash the food. Premolars or bicuspids in English, have flattened crowns like here, and two prominent rounded cusps. Premolars crush, mash, and grind the food, and usually have one or sometimes two roots. And the biggest teeth are molars. They're located behind of other teeth, and have flattened crowns with 4 to 5 prominent rounded cusps, and these teeth also are adapted for crushing and grinding the food. It is the biggest one. And you see that molars in the upper jaw typically have 3, 1, 2, 3 roots, whereas those in the lower jaw usually have 2 roots. So it is easy to differentiate these molars. If you see 3 roots, it is a molar from the upper jaw. If it is only 2, it belong to the lower jaw. During development, 2 sets of teeth begin to form. It would be deciduous in children, in baby, deciduous set and permanent set. Deciduous set of teeth usually have only 20 teeth. They start to erupt from 6 months. Usually first come the incisors of the lower jaw, then medial incisors of the upper jaw. When you see if you saw baby with 4 teeth, you never forget it, because this baby looks like a rabbit, and then to the age of 2 years age, usually all of 20 deciduous teeth are erupted. And permanent set, that is a set of teeth in adult, and usually the age of eruption, all permanent teeth, start from 6 years. So children change their teeth from 6 years till 21 years. So it is a quite long period of time. Maybe you remember this time. And the late erupted teeth are molars, of course, and they come to the surface of the oral cavity in the period of time when people are adult already, because 21 years it is the adult period of age, and we call these teeth as in Latin, how to say in English, sophisticated teeth, because it is a period of time when people start to be wise and to be sophisticated. Okay, and usually doctors use the special abbreviations, formulas, we call it tooth formulas. It would be abbreviated when we show only incisors, canines, premolars and molars. It is a abbreviated formula, but expanded formula, usually we use it in Russia Federation and some kind of former Soviet Union republics. But international formula in Europe looks like here. Each part we divided the all of teeth by the two lines, and we have four segments for two segments for upper jaw or for maxilla, and two segments for mandibular, and the central line divide that to the sectors, and all of first sectors have number 1 here, and all of teeth indicated with have special number, and then second is this one. This is the second segment, third segment, and fourth segment. So don't forget, we usually ask you about formulas, tooth formulas, when you pass the exam. You have to know these formulas. And a couple of words about tooth anomalies. It would be microdentia. This is it means that each tooth is smaller than normal, or macrodentia, like here you see the medial incisors are have a very large shape. It would be adentia when we couldn't see the tooth in the typical place. Sometimes it is a lateral position or vestibular position for the. Sometimes the shape of crown is for Fournier teeth. It is a special private name, Fournier teeth, and as well as Getchinson teeth. It is look like almost the same, but it is a defect of crown. And usually people who has Lewis, that is some kind of disease, we call here syphilis or Lewis. Those people with the Lewis have such shape of the teeth. It would be hyperdontia when we saw another couple or 3 or sometimes 4, sometimes 6 additional teeth in the oral cavity, some kind of rotation, and hypoplasia. It means that some kind of part of the teeth is smaller than usual. Normal occlusions. Normal occlusions is such as a clothing of teeth in which the incisors of the upper jaw covered here is the level of lower teeth, and usually it is visible that teeth in the upper jaw covered the front incisors of lower jaw no more than 1/3. So it means if we divided the teeth for the 3 part, usually when upper teeth is not more than to this line, it means a normal occlusions. And you see also that by normal occlusions, the upper molars and premolars are in contact with the lower molars. And that is a normal position. And pathological would be oblique occlusions. Here is a contact, but here is not. It is a gap. And direct occlusions, when it is not possible, no touch between upper and lower teeth. Next organ are salivary glands. Salivary glands, they actually we have two group of salivary glands in oral cavity. We have small salivary glands, what is located in the mucosa membrane, but outside of oral cavity we could find big or large salivary glands. Usually this is there are three pairs of large salivary glands in our body. This is first one is the parotid glands here. Parotid glands are the largest one, and their weight is about 20 grams, and they are located in inframandibular fossa. Here is inframandibular fossa, and those glands are located here. Parotid glands secrete saliva, and it comes through the parotid duct inside of oral vestibula at the second upper molars. Here it is the opening. Next one is the submandibular gland. These glands are found in the floor of the mouth along the medial surfaces of mandibula. Inferior to that is located submandibular glands. The duct of submandibular glands come through the milahyoid muscles and open into the mouth on either side of the frenulum of tongue, immediately posterior to the teeth. And the third pair of salivatory glands, called sublingual glands. Sublingual glands located in the floor of the mouth and covered with the mucous membrane. And each sublingual glands has plenty of sublingual ducts open along either side of the frenulum of the tongue. The frenulum of the tongue is here, and near here, opening here, a lot of openings of the sublingual glands located on this. This is a part we called it plica. It is a kind of line under the tongue. Next slide demonstrates function of the salivary glands, and I don't comment it. I would come to another organs, and it calls pharynx. Pharynx is the part of digestive tract, and it serves as a common pathway for food, liquid, and air. Usually, in this area, we have crossing the way of air inside of lungs and way of food or foodware inside of stomach, inside of esophagus and stomach. And pharynx serves as a passageway for all of stuff, all of food and air. Usually the length of pharynx is about 15 centimeters, and the pharynx is composed of skeletal muscles. It is visible here, and lined by mucous membrane from inside. Here you can see the part of the pharynx. Usually this is a three: nasopharynx in blue, oropharynx in pink, and laryngopharynx in green. And the nasopharynx usually is connected with nasal cavity. It is visible, blue arrow, and here the brown is a way of food. So only oral cavity, oral pharynx is a cross border, is a cross digestive and respiratory tracts. And here is also visible the pharynx inside. Okay. Topography. Holotopy of the pharynx come from the it is located in the head, this part. Nasopharynx and oropharynx are located in our head, but the laryngopharynx, inferior part, located in the neck. The skeletopy, it come from base of the skull, and it ends on the fourth 1, 2, 3, 4, 5, 6, for 6 here. Here this is the level of between pharynx and between esophagus, located down to the syntopy. Behind the pharynx, we could find muscles, and on the lateral side we could find some big vessels like carotid arteries and internal jugular vein, as well as vagus nerve. That is a combine of 3 important structure coming through the neck. Извините, я потом перезвоню, хорошо? Okay, so the structure of the pharynx wall, we could find mucous membrane here. This typical for all digestive organs. there are some muscles, skeletal muscles. They form tunica muscularis, and the external layer we called adventitia or tunica adventitia. And it is interesting that inside of mucous membrane we could find some organs. This is a combined lymphoid and epithelial tissue, and we call it lymphoepithelial organs, and they belong to the immune systems. Pharynx muscles here visible that there are constructors. They narrow pharynx and help to push the bolus towards the esophagus, and it is visible the superior constrictor, the middle constrictor is here, and the inferior constrictor is here. So 3 constrictors looks like a narrow pharynx, and a couple of levatos of pharynx. The most important is palatopharyngeal, second stylopharyngeal, and salpingopharyngeal. All of those muscles elevate pharynx up and help to process of swallowing. And that is the tonsillar ring I told before. This is a lymphoepithelial structures located on the upper part in the nasopharynx, between the palatinal folds. Here, this is visible tonsils, and we call that palatine tonsils or tonsilla palatina in Latin. They are parent structures. Pharyngeal tonsils are unpaired, and quite big tonsils located on the dorsal part of tongue, near to the root. This is one. This is a lingual tonsilla or unpaired structure, and small one located in the opening of the tuba auditiva. That is an auditive tube, and they compose the ring, and we call this ring tonsillar ring, or named by Pirogov or Valder. Valder is a personal name, as well as Pirogov, Professor Pirogov. They described this ring in the 19th century. Next is organ is esophagus, and it is a hollow tube that transport foods from the pharynx, here is the pharynx, to the stomach. And it is located in 3 parts: in the neck, in the cavity, in the chest, and in the abdominal cavity. So we divide esophagus for 3 parts: cervical part, chest part, and abdominal part. It is visible topography. Here is the cervical part, the longest is thoracic part, and the shortest, about 2 centimeters, not longer, is abdominal part of the esophagus. And skeletotopy, it comes from the 6 vertebra. This is the end of pharynx, and it open to the stomach in the level of 10 thoracic vertebra here. Usually the length of esophagus is about 35 33 to 36 centimeters, and it's located in the posterior mediastinum. And you can see the connection, relations, the esophagus with the other organs. We call that syncope. It is quite difficult, especially in the posterior mediastinum here. A lot of organs cross the esophagus, like aorta, like bronchs, and some veins, and some small structure not visible here. Usually each living person has 5 constrictions of the esophagus. Constrictions, it is a narrows of esophagus. But when people die, we could explore only three constrictions. So this is a constriction that can be explored in diet person. We call anatomical. This is a pharyngeal here. This is a bronchial constriction. This is a level of left bronchus. And when esophagus comes through diaphragm, that is the diaphragmatic constrictions. They are visible in living person, in a dying person, in corpse. But 2 of them, cardiac and aortical constriction, they are visible only in when people are alive. This is the structure of the esophagus wall. It is typical mucosa membrane here, muscles layer here, and adventitial layer outside. And this picture demonstrates swallowing phases or swallowing process. It starts from the oral cavity, then second phase we called pharyngeal phase, and the last one phase we called esophageal phase. And usually it takes about 3, 4, sometimes 5 seconds. And here some kind of anomalies, because it would not be the tube, it would be blind tube, or it is interruption between esophageal, and sometimes we have connection to the trachea or bronchs. Of course, all of these anomalies needs to be operated. Another no possible to be alive. And this is interesting abnormalities like diverticulus. Here it is appendices, or the another small part of the wall, and they usually it is a disease, and it also need to be operated. And interesting X-ray investigation after chemical burn. Sometimes people try to suicide themselves and drink some acid or some aggressive chemicals, and they get chemical stenosis and need to be operated also. And this one is very often we can explore such pathology like a hernia during when some part of stomach come through the opening in diaphragm and make hernia, diaphragmal hernia of the esophagus. Here is visible in the X-ray. Okay. Stomach is the last organ. I hope we don't have time to study small intestine. I will tell you next lecture in the second semester. But a couple of words about stomachs. Two names: ventriculus, Latin, and gaster. This is a name, a Greek name. That is a quite big portion of gastrointestinal tract, about from 1 to 4 liters in volume, and the size of the stomach is the shape. Sorry, the shape is like a letter G. You see, this is a letter G, little bit expanded, but this organ deposit food and located in the upper level of abdominal cavity. What kind of function stomach has? Of course, it is a food deposition. Food deposition up to 4 liters. It secretes some chemicals. It moves the food toward to the small intestine. Some kind of nutritions could be absorbed in the stomachs, especially sweet and glucose and alcohol. And it is also excrete some fluid with acid, produce hormones, and because of acid, it works as a protective organ, because this is acid kill almost all bacteria and viruses inside of stomach during digestive process. Topography. This is the upper part of abdominal cavity. Skeletopy from the 11 the upper margin of 11 thoracis vertebra, and the end opening is located on the lumbar, first lumbar vertebra, sometimes on the second, when the stomachs come down, especially for men who likes to eat or drink the beer. And the part there are several part or regions in the human stomach. First one we call cardia. Then this one is fundus or the fornix, in other words. The biggest portion is corpus or the body, stomach body, and the last portion we called pyloric part. That is connected with the duodenum. It is a beginning part of the small intestine, and it is has a special sphincter muscles who protect from the food easy come to the duodenum and before the process of digestion. Inside of stomach we could find a lot of mucosous membrane with a lot of folds. It is like a net folds, and in the mucous membrane we could find 3 types of glands. Main glands produce digestive enzymes. Parietal glands, they produce hydrochloric acid, which is what kills the microbes, and additional glands secreting mucosous substances, mucosin or mucin, to protect the mucous membrane for aggressive hydrochloric acid. All of these components call stomach juice, and this is three layers of muscular membrane in the stomach, and outside it is covered by serosal layer to help this organ to move easily inside. And I'd like to show you one interesting video about surgical operation, and for these people who like to eat a lot of hair. You see, inside of stomachs, surgeons elevate the pad of hair. All of these are hair. So look awful, right? And I don't recommend to eat hair, only good food. And let me finish our lecture today. I wish you everything best, and I wish you to pass the exams, and I hope the next semester you come here to Russian Federation, and we can meet each other in typical way and have our lecture here as usual. So thank you very much. Hope to see you next maybe next month in our anatomical lecture. And what else? Let's say goodbye.